Coronavirus has had a monumental impact on all areas of our lives. The world now seems plagued with alert signs to wash your hands, use sanitizer, and keep 2 meters apart as we all attempt to navigate this new normal. But what is it like working in healthcare, facing the day-to-day challenges of trying to navigate this novel virus? I spoke to Jackie Nudd, a senior nursing sister in primary care, about her experience.
The pandemic has thrown lots and lots of problems for us. The challenge is we all have to work to a code of conduct, and we have professional standards, and everything is done by guidelines. So when you're working with something that's unknown, there are no guidelines. So you're trying to work within professional responsibilities, knowing you're accountable. It's put huge obstacles in our way, and we've had to make new ways of working, which has been a steep learning curve for us as professionals, educating our patients and relatives. There's been an awful lot of emergency learning, and you might learn something one day on a Monday, and by Thursday you've got to change it because the goalposts have moved, because this is a novel virus, meaning it's new, it's unknown. There's a lot of people that need to come into us that aren't coming in, and it's about convincing them that they're safe to come in. So we're having patients who are actually quite sick, who are actually in crisis stage when they reach us.
Lockdown has limited our contact and interaction and changed how we carry out daily life, leaving many of us feeling lonely and isolated. For healthcare professionals, there is an added pressure.
I live on my own, which has its own problems because there's nobody. So you come home, you work in isolation at work, you're in a high pressure job with a very steep learning curve, a lot of responsibilities, a lot on your shoulders in worrying about what you've done that day for your patients. And I think all of us go home and mull over our day's patients. You feel very isolated. It's all quite overwhelming. Everything's overwhelming. You're overwhelmed at work, you're overwhelmed at home. You're wondering how you're going to juggle everything.
As lockdown begins to ease, healthcare professionals have been left in despair and fear, with many people breaking the rules, leaving the future uncertain.
I worry about the future following this pandemic because we don't know where it's going. People are being very flippant, very irresponsible, very selfish, very arrogant. They're not really thinking things through. And we have a lot of evidence to suggest in the medical press that this is not going to go away, that we now have a new normal way of living, and this is it for the foreseeable future. And if they carry on and they get this virus and they spread it to their family, if they want it, that's fine, that's their choice. But the people they're in contact with don't have a choice. It's despairing for the likes of us. I don't work in ITU, but I do know somebody who does, and they're on their knees and absolutely despairing that they're actually putting their lives and their families' lives on the line on a daily basis, knowing that a lot of those idiots at some stage are going to need our care, whether it's in the short term because in ITU or whether it's in the long term when they come to me because they got pulmonary fibrosis as a result of this dreadful lung infection. They seem to think they're immune to it. They're not. Being young does not make you immune to this disease. It really doesn't.